Hi everyone, this is Dr. Joe Comizio. First, as always, I hope that you and everyone around you are as well as can be. I just wanted to update you on the things that we're doing here at Comizio Orthodontics in preparation for returning to seeing patients on a normal basis, whenever that might be. Just a side note, I was speaking to one of my colleagues this morning. I was laughing and telling them that I'm guessing that, like myself, many of you can't wait for a visit to go see the barber or a hairstylist to get your hair cut. I feel like my hair is rapidly approaching the length that it was when I was in high school. But in any event, that was many years ago. In any event, first, right now, the pause by New York State Governor Cuomo is for May 15th. We don't have any certainty that we'll start seeing patients on May 18th, but we're hopeful. We think that we should. We certainly feel comfortable in doing that, and you should feel as well, we believe. The New York State Dental Association and American Dental Association is speaking to the governor about allowing that to happen. And there are a number of states who are actually behind us in the flow of, unfortunately, the spread of the COVID virus. For example, Virginia's governor declared that when the pause in his state expires at the end of this week, dentists and physicians can go back to seeing patients, of course, with good precautions, and they're just getting to their peak right now, just tiny bit past their peak. So in any event, we hope that will be the time when we will start seeing patients. We're not 100% certain of that, but we think that could be the case. Please, we want to see you, probably more than you want to see us, maybe, I don't know, but please do not try to contact our office to change your appointment or move your appointment. Our administrative team is totally aware of our entire schedule. We're doing our best to try to weave in 2 months almost of appointments for when we get back into the office. Of course, we're not sure when that is. We had that pause from the governor change from April 29th to May 15th, so we had to reschedule appointments once, but I assure you that anyone can do it. Our administrative team is the best at doing it with our templated schedule, prioritizing certain appointments for different things. We will get it done, but you don't need to contact us. There's little likelihood for you or need for you to do that, to try to move an appointment up because you think it will be back in the office. Obviously, your interest in doing that is shared by many, many, many hundreds of our patients, and we will do things that the best we can. However, some other helpful news, as I had mentioned in an earlier video, is that we are doing a number of virtual visits, certainly with all our Invisalign patients. When we do return to the office, our Invisalign patients will have other opportunities, especially our patients just starting Invisalign treatment, to do remote visits. We have a dental monitoring platform app now, and a very sophisticated, what's called a smile box for our Invisalign patients only, to take very regimented pictures of their teeth in between visits. So some of our Invisalign patients who are just starting treatment, if they choose and elect to do so, and I feel comfortable, or Dr. Sullivan feels comfortable for us to do it, we may see you every 4 to 6 months and have remote virtual visits with you through our virtual platform. So that's exciting, and that was something that was coming anyhow. It's just that the COVID crisis kind of pushed things into the present more. We also anticipate using that for our younger patients, our Future Stars Complimentary Orthodontic Guidance Program patients. Those are and the parents of those children know who you are. Those are our younger patients who are not quite ready to start any type of orthodontic treatment. We're monitoring you periodically every 6 months to keep an eye on the growth and development of the teeth and jaws to see when we might have to jump in and do anything. So I think that would be a great thing for our younger patients, because we always need to have a parent come in with them. That will be doing virtual monitoring with those patients as well. But again, we will contact you. Don't worry about it. We'll do that for you. Also, some of our other visits that might be checking retainers. we might do that virtually as well. If someone needs a new retainer, if it's within the last 4 years that we have digital scans of your teeth, and this is a reason that we weren't thinking of certainly 4 years ago when we went digital with all of our impressioning, so to speak, or taking footprints of the teeth. But we could actually reorder a new retainer for you and do that without seeing you, as long as we can see that your teeth will be okay to accept the replacement retainer, have it sent to your house. So a lot of really neat things are happening as a result of our efforts to try to move into maybe even the next phase of orthodontics, some teleorthodontics, so to speak. So we're really excited about that, and I hope that you'll be excited about it too. Another group of patients that will be easy ones to do monitoring on, unless you need to see us, are some of our younger patients who are having the palatal expanders that we check every 2 weeks. But we will let you know. Again, as far as appointments, please trust us, and I know that you do. Be patient with us. Our schedule is a little bit different than it was prior to the COVID-19 crisis, and we're working everything out with patients, and our administrative team is doing an excellent job in helping out with that. I know there's a number of patients who are eager to get their treatment started. They were all ready to get their braces on or their Invisalign on. Don't worry. Hopefully we'll be like a lot of the major airlines. We'll take off late, but we'll still arrive on time or even early with your treatment. So please don't worry. Let us concern ourselves with how to do things as best as possible for you, and I assure you that everything will work out great. When we do return to the office, we may have a difference in how we see patients. We are having a meeting on Monday to discuss that, the patients that actually will be on our schedule, how our patient flow through the office will be. Just because we're back in the office, we still have to take precautions. Of course, we take precautions all the time in our office, especially in our treatment areas, but there'll be some new things that we'll be implementing in our office with some barriers, obviously keeping everyone safe, our reception area, chair spacing. Unfortunately, we'll have to still keep suspended that coffee bar that so many of you adults and parents early in the morning like to hit on the way to work or dropping your kids off at school. So we're going to accommodate what we need to do right now for when we return to the office, and we're working hard and planning on those things. When you come to the office for visits, we may, and I'm not describing what actually is going to happen, but we're looking at different ideas about having our reception area partly in the parking lot, so to speak, to have patients wait in the car. We may request initially, possibly, that for our braces patients and Invisalign patients, particularly our adolescents, that just they come into the office and not have any other family members come into the office so we could get them in and get them out as quickly and as efficiently as possible. I know that there's a number of braces patients that I've seen for emergencies, for pain and wires poking you and whatever it might be. We're going to have a number of patients that will have to fix things, and more than usual during the normal course of the week. But don't worry, we will get everything worked out, we'll get it smoothed out, and please have confidence in our office that we're doing everything that's possible in having meetings to discuss our strategies, how we're going to do this. And of course, it's extremely important to us, for our staff as well, and our entire team, to have the right mix of safety, workflow, precautions in the office. And we're going to get through all this at some point, and this will be hopefully just an interesting time in all of our lives, and maybe in the course of humanity that we'll talk about with our kids and each other someday. But from as far as orthodontics goes, we are on it, we're planning, we're setting up, we'll be ready, and you can be 100% sure that we will be in a safe, organized, customer service oriented fashion that we've always been in our office. We don't like to leave anything to chance or miss anything, and we hope that we don't. And our administrative and clinical team, myself and Dr. Sullivan, are sharing ideas to get ready for when we do return to our office to see patients on a more normal basis, so to speak, and that will be hopefully sooner rather than later. So again, we think it might be the middle to end of May. We're not 100% sure about that. We hope that the governor understands that, especially in orthodontics, that these are patients that we really need to see to keep the ball moving with their tooth movement. So I will keep you posted for sure next week or this coming week to let you know how things are going and where we're at in our office. Okay, so as always, stay safe and of course keep smiling, and we'll be back to update you real soon. Thanks.